Here we have a great new device called the IDRA, which is a dry eye examination and diagnosis. So it's simple and straightforward. It sits on a normal slit lamp application. So here we have the device. We have different heads for different measures. So we have a Placido disc cone, which sits on the device, and this allows us to look at tear breakup time. And we also have another device, which is a white cone, which looks at the interferometry, the quality of the meibomian gland function and that lipid layer. So it's quite easy to put these cones on the front of the device and then just, with the device, look at obtaining some of the images. So here we have a laptop that just allows us to focus. And here I have the Placido disc looking at that quality of the tears, and we can see breakup time. Simply, I start a video, and the video itself will record the blinks and the breakup of the tear film during the course of a normal blink routine. So no instructions to the patient, just a normal blink, and then just analyzing that tear surface. We can also then take a little measurement along the lower lid, looking at the top of the tear meniscus, and then place another cursor on the eyelid margin, and that gives us the tear meniscus height, which is a valuation of the quantity of tears. The interferometry itself will actually look at the quality of the tears. So we have a measure in terms of how much tears there are, which would be an indication, if it was subnormal, of aqueous deficient dry eye. If we have a tear breakup time and the interferometry is anomalous, abnormal, we would actually say the quality of tears is worse, and that may well drive an evaporative dry eye condition. So interestingly, we have one of the key metrics, the key ways of measuring quality of tears, and that's actually the source is the meibomian glands. So using infrared light, we can actually image the meibomian glands. We just simply have to hold the bottom lid and put a little bit of pressure to actually avert the lid a little bit, and then just take an image. So we can see this is a no-touch procedure. It's something that, whilst I'm using the technology here, the clinician can use the technology, or even a nurse or a front of office staff. Being a no-touch procedure, it is simple, straightforward, and easy for a non-qualified person to actually undertake these tests. This is the advantage for me because it releases my time to see patients in a clinical environment. To perform the interferometry, you place the white cone within the device, and then you just move forward to focus on the iris, and then pull back a little bit, and you'll see the lipid layer moving upwards and associated with the blink. You just blink twice, and then keep looking. And you can see the movement of the lipid layer and the tears and the tear stability. To perform the non-invasive tear breakup time, we use the Placido disc, bring that in front of the patient, focus it on the cornea, and then ask the patient to blink twice, and then stare nice and wide. Keep staring, keep staring. That's great. We then have a measure on the computer, a digital objective measure of the tear breakup time. We may repeat this 2 or 3 times so that we actually get that recordable, repeatable, non-invasive tear breakup time.